From the Victory Studios in downtown Little Rock, this is Capitol View with your host, David Goins.
And good Sunday morning, everybody. Welcome to Capitol View. I'm Bob Clausen in for David Goins. I want to say thank you very much for joining us for this half hour. In this half hour, we'll be joined by Arkansas Surgeon General Dr. Joe Thompson on the eve of another special session of the Arkansas legislature. But we want to begin with Arkansas's former First Lady, Hilary Clinton, stopping by right here in Little Rock Friday afternoon. The former Secretary of State back in Arkansas promoting her new book titled Hard Choices, detailing her time in the Obama administration. Of course, we won't officially hear whether she is jumping into the 2016 presidential race for several months now, but there's still plenty to discuss just the same. David Goins had the chance to sit down with Mrs. Clinton one-on-one. Here's what they shared.
Hard Choices. The book has been out for a few weeks. A lot of folks who are out right now ready to meet you. What do you hope people take away from this book?
Thanks for asking that, David. I hope they take away that America really matters to the world and the world matters to America. We have to continue to lead. We are the indispensable nation. We've got to keep working for our prosperity and our security, and by doing that, we can try to help manage some of the difficult situations around the world. And I try to pull the curtain back in the book so people can get a front row seat in some of what I did during the 4 years there.
Not every Secretary of State writes a book afterwards. Was this more or less to see what 4 years of Secretary of State is like, or is it also kind of lay a foundation for what you hope to see in the future for the country?
It's both. Most secretaries have written a book, some more quickly after leaving than others, but they, I think, felt a responsibility to try to explain what they did and why they did it. And I accept that responsibility. I think it is important. You know, we're going to have a lot of challenges. You know, we see what's happening in the Middle East. We've got to end our presence in Afghanistan in a responsible way. We've got to deal with the rise of China. We have to see what we can do to help the rest of the world kind of deal in a fair and responsible way. So I think these issues matter. They matter in Little Rock, just like they matter anywhere in our country and anywhere in the world.
One of the things I've seen you kind of discuss on this book tour was the idea of on midterm elections that Democrats should own essentially what they've had with Medicaid expansion. Arkansas has had Medicaid expansion. Your thoughts on what maybe specifically what Arkansas has tried?
I have to compliment the governor and the legislature because I think Arkansas's solution was really a sign of creativity and leadership. I love Arkansas, and I know that hardworking people in this state deserve to have some peace of mind and support for their health care needs. And the way that Governor Beebe and the legislature, including the Republican leadership, said, let's come up with an Arkansas solution. And from what I'm seeing, it's really working. And I commend this state for taking on this difficult issue and doing so in a smart way.
One thing I want to ask you, because I'm about to become a parent, I know the president has talked about paid leave for Americans. Politically may not be palatable right now, but you've talked about that as well. Your thoughts on maybe where that can go in the future?
Well, congratulations first.
Thank you.
I'm about to become a grandmother, so I'm pretty excited, and you must be really thrilled. I don't think there's anything more important that any of us do than being the best possible parents we can be. Yes, we have to make a living, we have other responsibilities, but when it's all said and done, that is the most important work we will ever do. And I'd like to see our country support that work more than we are today. The first bill my husband signed when he went to Washington was the Family and Medical Leave Act. And although it was not paid, it saved people's jobs when that new baby was born, when that accident happened, when that aging parent needed your help. And I think we need to start looking at what's worked in some of the rest of our country, like California and some places that have had paid leave. It hasn't disrupted the economy. It hasn't lost jobs. But boy, has it provided peace of mind so that people can be the caretakers they need to be at different points in our lives.
And we are just getting rolling this morning. We'll have more from Secretary Clinton coming up a little bit later, including her thoughts on the future of politics right here in the natural state.
Feels like home. I mean, you've been living in so many areas. Does it feel like home to be here?
That is coming up in just a bit. Plus, Arkansas Surgeon General Dr. Joe Thompson joins us to break down the latest of the ongoing talks over the private option. I'm Bob Clausen, and for David Goins on this Sunday morning, you are watching Capitol View.
When giving it all up for love, try not to kiss off your old boss.
You know the IRS has been after my ass.
I quit. I've told you that several times already.
You don't quit on Gene Simmons, okay? Nobody quits on Gene Simmons.
Welcome to Sweden premieres Thursday, July 10th on NBC. Are you troubled by pesky legal problems? The law firm of Engels and Family will make them go away.
We are known as the Crazy Family.
Working the Engels begins July 10th on NBC.
Here's another reason to love Kroger. The savings are all around you. From the freshest produce to those everyday favorites your family loves, you'll find low prices throughout the store. Stop in and see how much you'll save with low prices and more. Every day at Kroger.
Sanderson Farms fresh chicken wings are $1.88 a pound in the value pack. And Southern Yellow peaches are 97 cents a pound. Great food, low prices at Kroger.
Every time you earn a paycheck, a little part of it went to pay the government for your Social Security disability insurance. When you paid in, you did your part. Now, if you can't work because of a physical or mental condition, you have a right to the benefits you paid for. At Rainwater Holt in Saxton, we help people get the Social Security disability benefits they deserve. Rainwater Holt in Saxton, 1-800-434-4800.
The sun used to make our outdoor deck and patio space so hot and uncomfortable, we couldn't use it.
But then we discovered the Sunsetter retractable awning. Our Sunsetter retractable awning opens and closes in just 60 seconds. It keeps our patio about 20 degrees cooler.
It provides instant shade and instant protection from the sun's harmful rays.
And our Sunsetter costs under $700.
But now you can get your Sunsetter for as little as $499 when you call now to get this special $200 discount certificate and free awning idea kit.
We love our Sunsetter retractable awning, and you're going to love yours too.
Sunsetter awnings are assembled in America and guaranteed to last for years. So call now to get this free awning idea kit with DVD, plus your $200 Sunsetter discount certificate.
But this is a limited time offer.
Call now.
Call now for your free awning idea kit with DVD and $200 discount certificate. There's no obligation.
Call 1-800-214-9329.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to Capitol View. I'm Bob Clausen in for David Goins this Sunday morning. Lawmakers are heading back to the capital city for the start of tomorrow's legislative special session. On Friday afternoon, Governor Mike Beebe adding a lottery gaming proposal to the agenda. Lawmakers are expected to ban the use of monitor-style gaming like Keno to the Arkansas Scholarship Lottery. The games allow players to buy tickets every few minutes and watch the results on a TV monitor. The lottery says the new games this fall will boost lagging sales, but Governor Beebe says he warned that this was the wrong way to fix that.
Well, there's no question they need the additional revenue, but yeah, I mean, you just don't do something because somebody needs additional revenue if you don't agree with the way they're doing it or agree with what they're doing. You know, part of this problem goes back to I told you so.
The other two big issues on the agenda, a second crack at controlling skyrocketing health insurance premiums for public school employees and a measure to ease the ongoing jail overcrowding problem statewide. The head of the Arkansas Lottery Commission says that he was prepared for all this to happen, and while he doesn't agree with the move, he says that he is happy to talk to lawmakers about the decision.
I'll say that the commission wants to stick with the current plan, but invites any alternatives or invites any type of changes to be sent over here, and they'll consider them when they have the opportunity.
The lottery also revised down the amount of money it expects to raise for college scholarships from $82 million to just over $80 million. The Old State House Museum prepping for 100 members of the Arkansas House, plus staff and the public, getting ready for them to converge in the museum that's located on Markham Street in downtown Little Rock. The current House chamber undergoing extensive renovations, forcing the change of venue, a rather unique one at that. It's been 30 years since the House gathered there in any capacity, and nearly a century since any legislation was passed in that building. The ACLU is asking the state court to block Arkansas's voter ID law immediately. The group, along with the Arkansas Public Law Center, is already suing to have the law struck down. Following the May primaries and runoffs, they say more than 1,000 eligible votes were thrown out because of the law. Former Democratic governor candidate Lynette Bryant crossing party lines to endorse Republican Asa Hutchinson's campaign. Bryant lost to Mike Ross in the Democratic primary last month, and she called Hutchinson a proven leader and praised his education plan. Bryant expressed frustration leading up to the primary that she was the only challenger in a statewide Democratic race. A Ross campaign spokesperson said they're used to Bryant's opposition from the primary. Well, the work starts now to reduce greenhouse gases in Arkansas following the EPA's new standards for carbon emissions. It's a little tougher here than in any other state in the country. Arkansas is being asked to reduce emissions by 44%, more than most states. And Arkansas is a coal-heavy state with several plants here. 24 stakeholders, electric companies, environmental groups, regulators, all coming together at the Department of Environmental Quality this week, trying to figure this whole thing out. It is the beginning of groundwork to figure out how the state can reduce greenhouse gas emissions over the next 15 years.
EPA has made it clear that they will accept ideas outside the box, that, as long as we can meet those emissions reductions goals that are set, we can use lots of different ways to do it. So I'm very encouraged that there's this much interest.
Members of Arkansas's congressional delegation worry electric prices and reliability will be affected. Public comment on this EPA rule runs through October, so still time to have your voice heard about this major change. A high-ranking state Republican official who made a controversial remark about Hilary Clinton resigned this week. Johnny Rota was the 2nd District Republican chair there. Earlier this week, U.S. News and World Report printed comments made by Rota. He said if Mrs. Clinton ran for president in 2016, she would, quote, probably get shot at the state line, end quote. State GOP Chair Doyle Webb says Rota was apologetic, but his decision to step down was the right one for the party. When we come back, Arkansas Surgeon General gives us some insight to the special session that's underway to take a look at teacher insurance, also taking a look at health care and where it is going from this day forward. I'm Bob Clausen for David Goins. You have a Capitol View this Sunday morning.
A great deal on a new car isn't just about the price. The car's part of the deal, too. Is it good or the best? Could it take you 100,000 miles or more? Is it really worth the price? Want a great deal? Head to your Toyota dealer during the Camry One event, because it's not a great deal if it's not a great car. During the Camry One event, drive a new 2014 and a half Camry LE for $199 a month for 23 months. Just $349 due at signing. Toyota, let's go places.
In times of joy, in moments of grief, we are there. When the world looks for truth, broadcasters come through, even when all else fails. Today, with more ways than ever to experience the moments that transform our lives, Americans still choose broadcast television and radio more than all other media combined. We are the local broadcasters of radio and television.
What can you get when you go to Vonage.com for home phone service? Unlimited nationwide calling for $9.99 a month for a full 6 months?
You betcha.
How about calling from both your home and mobile phone? Sure, pal. And how about over 25 great calling features when you sign up with Vonage Online?
Certainly, y'all.
What about getting our best offer ever? Totally. Plus, upgrade to Vonage World for just $2 more a month? See? So however you say it, let's make this a yes. Visit Vonage Online or call today.
Introducing the Outdoor Living Collection at Oak Express, a great way to enjoy life outdoors. All-weather construction, designer-inspired looks, and exceptional value. Mix and match the latest styles of patio furniture to make it yours. Exclusively at Oak Express inside Furniture Row. I simply love your accent. Where's it from again?
Sofa Mart, of course.
Hundreds of designs, styles, and fabrics to love. Only at Sofa Mart at Furniture Row.
Enjoy more restful sleep, relieve sore muscles, reduce stress. How about coming home to a hot tub from Townley? Hot spring spas feature the Ace saltwater system. It's virtually hands-free water care. Townley offers free-flow spas with plug-and-play technology, priced as low as $3,500. Fill it up, plug it in, and enjoy. Every day made better with a hot tub from Townley.
Ah, Townley.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to Capitol View. This Sunday morning, we are joined by Arkansas Surgeon General Dr. Joe Thompson. We're going to kick off things off with a little bit first. The special session starts tomorrow, first thing in the morning. Obviously, teacher insurance is the issue. What's your take on that this time around? This is the second time for this.
Well, our public school insurance program has been in trouble for a number of years. Effectively, the schools are not buying in enough of their population to provide enough healthy people to pay for the sick people. And that requires an infusion of cash every so often. Hopefully we can get to a point where we have a stable insurance pool that we don't have to go through the annual assessments like we're having.
Because this is one of those things, if we get back here, then obviously we need a long-term fix somewhere down the road. Let's talk about the private option. Healthcare as we know it is evolving. Some say for the better, others say otherwise. Something that you want to talk about though are the independence accounts. And these are something that a lot of folks have got to get educated on.
Well, we're about 6 months into the private option. We have about 180,000 people in the care, about 160,000 in health plans. These are people that did not before have health insurance, most of them, so they don't know how the health insurance system works. The legislature put into the original legislation and reinforced in the last fiscal session both the incorporation of cost sharing, co-payments, and independence accounts so that people could see how the health insurance system worked.
What are some of the things that they're going to see that they'll recognize, some things that they're going to be completely foreign to them?
Well, many of these folks, the only place they've been able to go to is the emergency room for care, which is usually the most expensive and least effective place for most of your common conditions. So through their independence accounts, they'll be able to see that the co-payments would be higher if they went to the emergency room than if they go find a patient-centered medical home and get better outpatient services.
And this is kind of getting people acquainted with more or less how health insurance works, because we all pay in, we all understand that we have a copay, but you know, for the folks who have got the right insurance plan, our copay certainly is minimal.
The whole Affordable Care Act started to try to get people to have insurance, number one, and know how to use insurance, number two. Starting at about $45,000 a year for an individual, people get help with tax subsidies to buy the health insurance. They have co-payments. Starting at about $15,000 a year in our private option, we're adding co-payments and the window in so that they understand how to use the system.
If there are folks that are going to approach the system and say, look, I'm not supposed to be paying anything into this, this should already be provided for me.
There are some individuals, particularly at the lower level, below $6,000 a year, for which we are still going to protect against cost sharing or co-payments. But starting at $6,000 a year, they will have some nominal fee, $4 for a visit. If they pay into their independence accounts, let's say $5 a month, those co-payments would be paid for them and they'd be protected from that out-of-pocket expenditure.
The legislature, when it comes to the private option, I know that there was a point where we really didn't have a vote to spare for it. And where are we going to be down the road on this when this comes up again?
Arkansas has the highest bar to spend a dollar of any state in the nation. 75% of our Senate, 75% of our House have to vote yes each year. We had no votes to spare last year in the Senate. So each and every year we're going to have to get that 75% or the private option goes away. The program is working. Our hospitals have seen a 2% reduction in ER visits, a 25% reduction in uncompensated care. Our providers are reporting better care and outcomes for our patients. I'm hopeful that next spring, when we're in the legislative discussion again, our legislators vote for what's right for Arkansans, not for the political polarization that's happening at the national level.
And we have to understand, too, that Arkansas is more or less under the gun. We're really feeling the pressure on this, not just to get it done for Arkansans, those folks who need health care, but because a lot of people are looking at this particular program as a model.
This is a new and creative new way to deliver health care to poor Arkansans, and other states are looking at this for their models too. Iowa, Michigan, Utah are looking to say, is the private option the right way to go for us? Because it does not expand state government, but it achieves the necessary coverage for low-income Arkansans that otherwise would not be able to afford it.
What are you hearing from other states?
We get phone calls. I think the Department of Human Services in my office get phone calls on a weekly basis. When we go to national meetings, people want to know, is it really working? I think there is a lot of interest nationwide to say, is this the new face of federal support for low-income Americans to be able to afford health care?
And what kind of things are you getting out of the legislature as far as guys that are on the side of, I think for the most part, a lot of folks realize that, wow, we got to get some sort of health care plan out there. Some folks saying this is the best approach, we need to do something else.
Well, we have a majority of the General Assembly, both Democrats and Republicans, that voted yes 2 times for this. We have a small minority of the more conservative side that have, for whatever reason, not seen the benefit for Arkansans, but are being, I think, used by some of the national pundits for why the president did the wrong thing with the Affordable Care Act and the nation's going in the wrong direction.
Let's talk about that, especially when it comes to the issue of health care. And we've seen campaigns and time again, even more so this cycle, that outside money being spent for issues that don't even pertain to the folks who are spending the money. It's a local issue, but yet they're trying to defeat it or support it. And when it comes to health care for you, Surgeon General, it's got to be a little frustrating.
Well, we are consistently at the bottom of national rankings on health. We're consistently at the bottom of the national rankings on coverage, and those things go together. We finally have an opportunity to be able to remove the financial barrier that people have had to get the care that they need when they need it, and to be able to take advantage of preventive care to avoid that care altogether. I think it really is a foremost responsibility of our state leadership to pursue and use this opportunity. I'm not saying the Affordable Care Act was a good or bad option, but let's take advantage of what works for Arkansans.
Exactly, and what we have that's available right now. Education is so important. Even now, we've been talking about affordable health care for a couple years at this point. Still a lot of folks behind the curve when it comes to understanding what it is and how they can get involved in it.
Health care is complex. How to keep yourself healthy, where to go, when to go. It's a very strong health literacy deficit, and we've got to start educating people. These independence accounts are intended to be windows so that we can actually start to have dialogue and discussion. Other aspects that we're changing in our healthcare system, the Payment Improvement Initiative with patient-centered medical homes that are forming teams of clinicians to actually help patients not only get the care they need when the doctor needs to make a prescription, but the education they need on nutrition or physical activity or smoking cessation. We're revamping the Arkansas healthcare system, and it appears to be making a difference.
One thing, too, and I think there was, I don't know if this was a recent study, but it was something I was speaking with a physician about, and when you take a look at the health of folks who live along the Mississippi River, I guess the farther south you go, the more unhealthy people get because of access to health care, because of, I guess, income. Is that something, that a tide that we can change ever?
Well, I think one of the things that we have successfully made the argument to the business community is health and productivity go together. If we want to attract businesses into our state, if we want to expand the businesses that are here, we have to have a healthy and productive workforce. When we're one of the sickest populations in the nation with some of the most costly health care needs, that works against our business interests. So getting people healthy helps them be productive and more attractive to other businesses to come and locate here.
All right, Surgeon General, Dr. Joe Thompson, thanks very much for spending time with us this Sunday morning.
Thanks for being here.
Have a great week. When we come back, we're going to have more from Hilary Clinton, including her unique insight into the big races right here in Arkansas.
This is where our daughter was born. This is where we still have so many deep friendships.
I'm Bob Clausen, in for David Goins, and you are watching Capitol View on Sunday morning.
Ferguson's 4th of July Lazy Boy sale saves you hundreds on top-of-the-line recliners, sofas, and sectionals. Take up to 48 months interest-free and get statewide delivery on Lazy Boy Furniture at Ferguson's Furniture next to Walmart in Benton and at fergusonsfurniture.com.
The biggest chicken breasts in fast food. And we mean everybody. Introducing the Big Chicken Sandwich, dusted in southern spices. Only at Hardees.
The Mercedes-Benz summer event is here. Now get the unmistakable thrill and the incredible rush of the Mercedes-Benz you always wanted. But you better get here fast.
Hey, Daddy's here.
Here you go, honey.
Thank you.
Because a good thing like this won't last forever. See your authorized dealer for an incredible offer on the exhilarating C250 Sports Sedan. But hurry, offers end soon.
We bought 2 rooms of floors from Empire today and got flooring for this room free, and this room free, and this room free too when we paid for installation.
It's Empire's whole house sale. Buy 2 rooms and get flooring for the rest free when you pay for installation. Get quality floors from trusted brands like Armstrong or Doll Tile. Don't miss. Buy 2. Get the rest free. Schedule now.
800-588-2300 Empire.
Today.
Ferguson's Furniture in Benton is having a big 4th of July sale on American-made USA leather furniture. You save hundreds on sofas, sectionals, and recliners, and take up to 48 months interest-free during Ferguson's big Made in America sale next to Walmart or at FergusonFurniture.com.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to Capitol View. I'm Bob Clausen in for David Goins this morning. Former Secretary of State Hilary Clinton making her return to the natural state as part of her book tour. The former Arkansas First Lady, very in touch with local politics. David Goins asked her about the political landscape of the state. Here's what she had to say.
Here in Arkansas, I know what feels like home. I mean, you've been living in so many areas. Does it feel like home to be here?
It really does. I mean, I've been fortunate because, as you may know, I was born in Chicago, grew up in the Midwest. Obviously, I went to school in the Northeast, and then met somebody named Bill Clinton, and had a wonderful time living here in Arkansas. This is where our daughter was born. This is where we still have so many deep friendships. This is where the library and the Presidential Center are located. And I was talking to my husband when I landed last night. I was coming from California, and he said, "Oh, I'm so jealous you're going home." Of course, we live in New York, but we spend time in Arkansas, and we have such a great sense of commitment to the state, and we want to continue to be good contributors in every way that we can to a state that we both love.
How have you seen Arkansas, maybe from a distance, kind of change politically? Because obviously the South, went red in '94, and Arkansas always kind of held on as a, populist blue state. But that's started to change. Where do you see a foothold potentially for Democrats in Arkansas, or is there one still?
Oh, of course there is. One of the things about Arkansas is that people like to have a personal relationship with their leaders. They really want to get up close and personal and try to see, who is this person? Does he share my values? Does she agree with what I think should be done for the state? And so I think it comes down, as it has historically in Arkansas, to the chemistry between candidates and officials and the voters. And we have some great candidates running here. Obviously, it won't surprise you to know I've known Mark Pryor since he was a very young man, and worked with him when we were both senators. I've known Mike Ross. I've known James Lee Witt. I've known Pat Hayes. I know these people. So put party aside and look at the person. Look at what they stand for. Look at the values that they bring to their public service. So I think this has the potential to be a very good election. Of course, it depends upon who turns out and what the quality of the debate is.
Quickly on marriage equality, that's something you're in support of. Arkansas was the first southern state to grant same-sex marriage licenses. That's not going on now, but your thoughts on kind of where that's going?
Well, I think this is an issue that is sweeping the country for a very simple reason. Americans believe in equality, and as I've said, this is an issue that I certainly have evolved on, as many others have over time. But at root, it is the recognition that our fellow citizens should be able to form relationships that are of integrity, recognized by the rest of society, with whom they love, and we believe that marriage equality is a step forward in making good on the promise of equality in our country.
And last one, Secretary, obviously you're in the city of Little Rock. Do you have any plans, maybe in a couple of years, to ever run in the Little Rock Marathon?
Oh, that's a great question, David. I am not much of a runner, and I'm about the slowest runner you'll ever meet. I'm more of a tortoise than a hare when it comes to running. So I'm not working out and planning to do that. I'm just trying to kind of keep myself going. But that's a very interesting invitation. If lightning strikes and I ever have the capacity to do that, I'll do the first one here.
Politics is a marathon in and of itself.
It is. It is. And, you know, life's a marathon. You go through different stages in your life. I'm about to enter a new stage as a grandmother, and just enjoy every part of it and make the most of it, and also give a helping hand to others so that they can have the same kind of lives.
Former Secretary Hilary Clinton, thank you so much.
Thank you, David.
Very nice
Good to
meet you.
talk to you.
Thank you.
And that does it for this morning's broadcast. I really want to thank you very much for sharing this part of the Sunday with you. Don't forget, you can stay up to date with Arkansas politics by following us on Twitter at Capital View AR, and download the Capital View smartphone app in the iTunes App Store and Google Play. We will see you next week, everyone. Have a great week.